My name is Saeeda Chowdhury. I'm one of the hematologists, oncologists with Prisma Health Cancer Institute. I am originally from Bangladesh. That's where I went to medical school. I came to the US in 1990 after finishing medical school. My husband was a graduate student. He did his PhD at Yale University. And I came as a spouse and then took my board exams and then did my residency in New Haven, Connecticut, and later on did my hematology fellowship at Yale School of Medicine. Hematology was always something that drew my somewhat interest, and I always felt closer to the patients who had either hematologic or oncologic disorder. I kind of felt close to them in their journey. I think it's my patients. I get to see from the beginning and sometimes to the end of their journey, and many a times we are able to cure their cancer, improve their quality of life, and in fact, even if they are dying, we can actually make that experience tolerable and sometimes beautiful. That makes me come back to my job every single day. I do have a focus in hematologic malignancies and in bone marrow transplant. These days we are doing other things in addition to bone marrow transplant, which includes CAR T treatment. We also run a donor program for National Marrow Donor Program. So we have a full-service apheresis program as well. And we also participate in a lot of clinical trials. Humanistic. I think that's how I would describe my practice. My patients become part of my family, and that's how they're treated. They have access to me sometimes 24/7. Most of them have my cell phone numbers. I'm at their service at all times for the most part. That's my style. Prisma has given me a platform where I can practice my medicine the way I want it. They do not tell me what to do, who to see, who not to see. I get to choose. I get to do what I like doing. And that's why I like Prisma. I love to cook. I cook for my staff. I cook for philanthropy. And I actually feed my patients too sometimes. Besides what I do in the office, in the hospital, that's what I like doing. I advise my patients to have an open-minded approach to their care because things change, and to have a real perspective. Also to have a positive attitude. I think in oncology, attitude is 90%. If you wanted to make an appointment to see me, please call the number on the web page, and our schedulers will be happy to schedule your visit.